I had a scar on my chin that we didn't know what it was. I was being treated for that with the dermatologist. Gradually, it became the whole left side of my face turning different colors, and we found out through the diagnosis what had happened. Within 5 seconds of meeting him, he knew automatically that I had Parry-Romberg syndrome.
Angela has Parry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence. You start to notice sometimes pigmentation changes of the skin, usually around the eye, side of the cheek. And then slowly over time, the tissue tends to just wither away. When it's done, it leaves the person with severe facial asymmetry.
A lot of the kids in middle school were really mean. I had a few nicknames that were not so nice. I would go to the mall and random people I didn't know would ask me, "What's wrong with your face?" I'm just thinking to myself, I'm fine, you know, I'm normal, because I don't see it when I look in the mirror as other people see it.
We try and do most of that reconstruction with soft tissue. We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. The stem cells that exist within that fat, while young, are better than they're ever going to be going forward. And they're going to have more activity and more resistance and more viability than they will in 10 years. And that's what BioLife does. It's because of patients like Angela that the stem cell bank and fat preservation bank is in existence.
I can confidently go into a mall now and people don't ask me anything. They don't notice.
We want to help all these kids be able to walk into a room confident in who they are, confident in their ability to express themselves and to present themselves to their friends or their teachers or even to people that they don't know.
I would recommend Dr. Genecov for just about anything, especially if you are going through Parry-Romberg syndrome or something similar. He's done so much for me. He can make you feel better, not just physically, but mentally.